The biggest piece of news in all households across the country now is that finally it is our turn. And starting from the 1st of March, people above the age of 60 and those with comorbidities above 45 will be eligible for the vaccination. Also, this is the second phase. That means private hospitals as well have been given the license to do it. But in that case, you will have to pay for the vaccine. But just about 4 days to go, that's pretty much what we know from the government about the rollout process. But don't get anxious, NDTV has spoken with top sources in the health department and this is what we have gathered. First up, the cost of the vaccination. So currently the vaccine costs between 200 to 295 to the government. So roughly that's the range we are looking at after covering some overheads like syringes and human resource. The vaccines in private hospitals are likely to cost around 300 rupees. And also, like in the case of COVID testing, the government of India is likely to cap the pricing as well. So private hospitals can charge less than 300 rupees in cases but not more. Next up, who gets this vaccine? So if you are above 60, you automatically qualify. But for those with comorbidities above 45, sources tell us that deciding your eligibility will be a one-page medical document. One page that the government will make soon public to all of us, and it will have a list of 20 diseases. You simply have to tick yes or no, saying whether you fall in that severity category or the risk zone. And then you have to get that signed by a registered medical practitioner. Upload it on the app and your work is done. But how will you get the slot? When will your turn come? Well, for that, speaking with top sources, I figured out that they indicated that it would be something like booking a railway ticket. That means first come, first serve. And like you have to log in on the IRCTC to book your ticket, you will have to log in on the CoWIN app in this case. And since there have been several glitches reported in the past as well about the CoWIN app, walk-ins will be allowed. But so far we are told only if the jabs remain unused at the end of the day. Also, private hospitals will only get specific number of doses, and to ensure that there is no black marketing, no jumping of the queue, they will have to upload the details of the individuals that they are vaccinating on the CoWIN app. The government will then match it up with their own electoral list to get all those details. Now, registrations will begin once the CoWIN app is declared open, and the date of that is still awaited. And which brand of vaccine will you get? That crucial information the government currently not speaking about. On the whole, we are learning that this phase will be quite inclusive. So get your hints right there. Sonal Mehrotra Kapoor, NDTV.